From your work in all these nonprofits and patient advocacy organizations, what do you think we need to hear the most from the patient?
I think you just need to not assume that you know what a patient wants. You need to listen and really listen and ask more questions. I remember meeting this doctor one time at a conference, a medical conference, and he was from Egypt. And we were talking about advanced liver cancer. And he told me that with his patients who had advanced liver cancer, that he didn't tell them that they were going to die. He didn't tell them it was a terminal diagnosis. He didn't give them any options. He didn't discuss palliative care and what that means. And instead, he just treated them until they died. And so I asked him, well, what would you do if you were diagnosed with metastatic hepatocellular carcinoma tomorrow? What would you do? And he told me all these wonderful things. I would, apologize to my father. I would, take my wife on this trip. And I said, oh, so there are things that you would like to do before you die? And he said, yes. And I said, well, why don't you give patients that option? I said, if you had real conversations, you would allow your patients to have choices. But instead, you are treating them and not giving them a real picture. And I can't tell you how many times, Mark, a patient has believed that because the doctor's treating them, that the treatment has to be curative when it's not.
Mm.
It's often palliative.